Hey, in our attempt to be sensitive to the health needs of the community, we've taken another step in the direction of our total whole child health by unveiling our new mobile health lab. Our new mobile health unit is integral to the work that we do in the district because in order to get academic outcomes, you have to have health outcomes that are positive as well. So when we think about children, we don't just think about school. We think about family, we think about vision, hearing, dental. We think about the whole child. I want to thank the Board of Education for allocating the money, transportation for doing the research, but I really want to thank Lisa Miner. She really has spearheaded this. As the associate superintendent, this has been her baby to make sure that kids are taken care of. So with that, I will give it to my partner.
Thank you, Dr. Lawrence, and thank you to the Dayton Board of Education and especially our treasurer, Abraha, who helped us actually pay for this. Many of you know about the COVID dollars that districts received throughout the nation. We used our COVID dollar to purchase a brand new mobile health unit. We know health and wellness, as Dr. Lawrence said, is number one, in addition to a high quality education. And so we're very excited to have the ribbon cutting today for the mobile health unit. It's going to serve not only as a vehicle for wellness, but it's a vehicle for education, as the Dayton Public Schools also offers allied health education throughout the city. We have a nursing assistance program at Dunbar High School, Thurgood Marshall STEM School. We have phlebotomy at Belmont. We have phlebotomy at Dunbar and Thurgood, and we have a surgical tech unit at Meadowdale CTE, as well as Ponance CTE that has nursing assistants and many allied health. So those students will also be able to get work-based learning on our mobile health unit. So it's not only a health unit for our wellness, it's a health unit to educate the next generation of medical professionals in the workforce. And so we need our staff and our wonderful nursing department to run the health center, the mobile health center. So I will turn it over to Nurse Parks, who's going to give us more information on the history of the mobile health unit that is not new to Dayton Public, but this one is new, and she'll tell us more about it.
Thank you. Hello and welcome, mobile health unit enthusiasts. As the school nurse for the mobile health unit, it is an honor to be a part of this most special celebration. I would like to thank Dr. Lawrence, Associate Superintendent Lisa Miner, DPS school board members, and Mr. Beard for seeing the tremendous value of the mobile health unit to Dayton Public Schools students and families and making this dream come true. The mobile health unit is a joint venture between Dayton Public Schools and the community health centers of Greater Dayton. The mobile health unit visits every school in the district on a rotating basis, providing asthma education and medical management for DPS students with diagnosed, reported, or suspected asthma. I started at DPS in the fall of 2021 and was thrilled with my assignment. Get the mobile health unit on the road again after the long COVID shutdown. I consulted with the previous mobile health unit school nurse who shared her knowledge and passion for this needed health service. From her, I learned the daily operation, procedures, and its mission. Through patient and family education and medical management, we strive to achieve well-controlled asthma, enhance asthma self-management skills, reduce asthma-related school absences, and reduce asthma-related emergency department visits and inpatient hospitalizations. After hiring a driver and pediatric nurse practitioner, and with the help of DPS school nurses filling the schedule, the mobile health unit was finally ready to make its first stop at Bellhaven Elementary on April 7th, 2022. That spring, we were happy with the response and successfully visited every elementary school. 87 appointments were booked with 57 visits completed. The following school year brought even more success. We were able to visit every DPS school. Our appointments grew to 198 with 117 visits completed. While all of our DPS students benefited from their asthma checkup and enjoyed watching the Iggy and the inhaler videos, several cases stood out as critical for the students' well-being. The elementary student presenting with shortness of breath, wheezing, and low oxygen levels, who was taken directly to Dayton Children's Hospital emergency room for further evaluation and admitted for several days of inpatient asthma care. The high school student suffering from uncontrolled asthma, unfilled prescriptions, homelessness, and emotional trauma, who could not make her appointments at Dayton Children's Pulmonary Clinic. Our wonderful pediatric nurse practitioner, Anne Marie Schmiersel, consulted with the student's doctor at Dayton Children's Pulmonary Clinic, making it possible for us to provide the exact same care and treatment plan on the mobile health unit. We had accomplished so much in such a short time, but unfortunately, in January of 2023, the mobile health unit broke down and was permanently garaged, even after attempts to make the needed repairs. Whether it is reviewing asthma symptoms via history or physical assessment, or demonstrating and reinforcing correct inhaler technique, or checking with parents and students about medication compliance, or making informed referrals to outside agencies, or providing inhaler and asthma medication prescription and refills, I am proud to say the mobile health unit filled the gap and provided the extra medical services needed to manage the complexities of asthma for DPS students and families. Now let's fast forward to August 14th, 2024, the arrival day of our big, beautiful, shiny, brand new mobile health unit. I literally could not hold back my tears of joy. What a blessing for DPS students, families, and staff. I can't wait to get started again and make it more successful than ever. Discussions are underway to expand further needed medical services. The possibilities are endless. The sky's the limit. It's go time. Now let's get to work.
I am Jordan Harris, Health Services Director with Dayton Public Schools, and I cannot express how proud we are to serve with a leader in Dr. Lawrence, who champions the holistic needs of our students. So in an effort to better meet those health needs, behind me you can feast your eyes on the solution. It's not easy for students to be their best self and perform at their most optimal levels when they are suffering with underlying health issues. So this mobile unit will serve with our school nurses who can play a major role in assessing the students at each of our schools on an individual basis, and then they can refer them to the health unit as needed. And then along with their academic transcripts, students will be given a health transcript so that they can ensure that we are effective in meeting the students' needs. Montgomery County is designated as a medically underserved area and a health professional shortage area. So this unit is definitely needed, and one of the many ways we are seeking to create innovative ways to address the holistic needs of our students. So our goal is to educate students not just for their diplomas, but we are educating for a lifetime. And our vision is to equip students with the knowledge and health principles to improve health literacy and improve outcomes for the rest of their lives. So with that, it is now time for the ribbon cutting.
Okay, all right, let's have at it.